Hello and welcome to this GIS report with Health in Perspective. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Ledsom. The Virgin Islands is on the verge of claiming the elimination of mother-to-child transmission of HIV and congenital syphilis. An evaluation team from the Pan American Health Organization, PAHO, and the World Health Organization, WHO, is in the territory this week to commence a 3-day evaluation to confirm the possibility. On the program today, we will be speaking with key personnel within the evaluation team to learn more about the process and to find out where we are as we as a territory seek validation for the elimination of mother-to-child transmission of HIV and congenital syphilis. On the program today, we will be speaking with Dr. Miriam Chickie More, Dr. Rand Ballard, and Ms. Noeline Evans. Welcome to the program.
Thank you.
Thank you. Now, Dr. Chickie More, we want to start with you first off. Welcome. Can you introduce yourself, tell us a bit about your background, and we'll go further in.
Thank you, Natasha. I'm a public health specialist and a medical doctor. I'm originally from Zambia. I work in Kingston, Jamaica, and I'm heading the UNAIDS regional program for the Caribbean for the last 6 months. But I've been in the Caribbean now for 3 years. My role obviously is in participating in the regional validation committee, but I'm also a member of the global validation committee, which sits in Geneva. Right. So it's my pleasure to be here.
Okay, welcome again. Now, what exactly is the process behind the elimination of mother-to-child transmission of HIV and congenital syphilis?
Well, as you know, we've had the epidemic for over 30 years now, and many interventions have been put in place. And what we're aiming for now, that treatment access is widespread, we're now moving to universal access. We're looking at ending the epidemic by 2030. One of the earliest programs to be implemented was prevention of mother-to-child transmission of HIV. And with improved drugs and destigmatizing, the HIV, the pregnant women and women in general had more access to the interventions. And one of the priorities was to prevent children from being born with HIV because their mothers were HIV positive. And most countries love that program and really supported it. So after so many years of implementing it, we have realized that a number of countries have actually attained the goals and the targets that were set forth, and they've actually able to demonstrate elimination. So they prepare a country report, and our job is to come here and see that those targets have actually been met.
Mm-hmm. Now, what exactly is elimination?
Okay, so elimination, in this case, it's what we call virtual elimination, because we set initially the short-term course antiretrovirals were only reducing mother-child transmission by down to 20%. And then with the advent of highly active antiretroviral therapy, and when the prices were greatly reduced, we were able to put more people on treatment, so we could start almost all our mothers on highly active antiretroviral therapy, which meant that the viral loads dropped significantly. So during pregnancy, that virus was not being transmitted to the babies. However, we still had a portion of children that even when the mother's on treatment, she diagnosed during pregnancy, that about 2% of infants will still be born with HIV. But we said that if you can effectively start all your positive pregnant mothers on treatment, you shouldn't have more than 2% transmission to the children. And there's a caseload as well for countries with much smaller populations and smaller numbers. And those targets were set that if you can attain those targets as a country, because some countries still have very high transmission rates, 15, 20%, even higher, 30%. But the countries in the Caribbean, most of them have attained those targets. But the question is, how have they been reached? And can we come and validate and see that the records have been kept, actually live up to that standard? And if you have actually reduced mother-to-child transmission below 2% or below and met the caseload that is required, then we can say it's eliminated, but it's virtual because there'll still be a small portion 1 or 2 babies that are still born with it, maybe because the mother came late, or we're not able to reach the woman on time with the necessary interventions for whatever reason. But we still say if it's 2% or less, that it's virtually eliminated.
Nice.
It's not eradicated, but eliminated.
Great. Now, you briefly spoke about some of the processes. When doing your evaluation, what is it exactly you're looking for?
Right. So the elimination process was agreed upon at the global level by WHO, but PAHO actually initiated the standards. So we have 4 components for validation. We're looking at the service delivery and how have the services been packaged, and how are the records being kept, and how are the women being seen, and so on. And then there's the laboratory component, and Dr. Ballard will speak more to that component. And then we have a fourth component, which is the monitoring and evaluation, a third component, which is monitoring and evaluation. And that basically says, how did you come up with these numbers, you know, and how did you arrive at, you know, the fact that you say you have eliminated. And then the human rights, community engagement, agenda component is the 4th piece, and that's the piece that I am leading on. Basically looks at the context in which all of this was implemented. And so those 4 components are critical. And the country prepares initially a report on the 4 components, and there's a structure which has been presented. And then the ministry writes to the Pan American Health Organization and a Minister of Health, and then they they review what's been prepared, the report, and then they'll decide whether it's the country qualifies now for validation. And a team will be put together of experts. Some of us are from the Regional Validation Committee, but we have experts like Dr. Ballard and other external experts around from the region and external to the region that we bring in, because it's nice to have an independent eye. And then that team will come to the country, time is agreed on, the agenda is agreed on, even the tools are already shared with the country. So then we come in and we go through the process of evaluating those 4 components.
Nice. And give us an idea of who the rest of your teammates are.
All right. So we have two people who are not with us. Okay. 3 actually. We have Dr. Mary Camp, who's from CDC. Dr. Mary Camp is a specialist actually in syphilis and service delivery, maternal health services. So that's the component she's really focusing on. And of course, Dr. Ron Ballard for the laboratory. And then we have the PAHO Secretariat. We have Ms. Sandra Jones, and we have Dr. Perez, who are also supporting us through the process.
Nice.
So it's a team of, how many are we? 5 people.
Okay.
Yes.
Well, thank you very much for that intro first, to get us a better understanding of what the process is and what you're actually looking for. Now, Dr. Ballard, tell us a bit about yourself and the role you have on the team.
Okay. Well, I'm actually retired, but PAHO pulled me out of retirement because I used to be head of the STI lab at the Centers for Disease Control in Atlanta, Georgia, and then moved into global health, and I was the associate director for laboratory science at the CDC, and so it's great to come back to the field again. And before I went to CDC, I was the director of the National Reference Center for STIs in South Africa, where we used to serve the whole of Southern Africa. So it's great actually to be back in the field and looking at labs again.
Now, how instrumental are the laboratories to the evaluation process?
Well, the labs are crucial to any kind of assessment or any measurement of what's going on in a country. And the reason is because most of the diagnoses are made on the basis of lab results. So it's very important that we're comfortable that the lab is actually producing good quality testing and that the right results are going out, because on the basis of those results, people are classified as free of disease or infected. They need to actually have treatment or not, whether that's HIV or syphilis. And
whether the treatment is working or not.
And of course, ultimately following and monitoring the patients after they've been diagnosed. So it's essential that the labs actually produce accurate results.
So
because we depend upon them, eh?
Definitely.
Yeah.
So what type of methods are you using with this evaluation?
Well, once again, we get the country report, which has a lab component, and together with the data which is generated, both clinical data and the lab data, we look at it and they describe the lab setup and the fact that there's a public and a private sector, and the fact that they use these particular methods and they use particular algorithms or channels whereby they come to their results. And we decide on the paper whether or not this is up to international standards. And the answer is, on paper, it's quite clear that that's the case. And then once we've asked a few questions and they've changed the initial report, we come in and we physically look at the lab, at the documentation, the training of the personnel, the way in which they maintain their instruments, the tests they use, make sure that they're in date, make sure transport of specimens occurs, know what they do with those specimens, and the fact that they have to, unfortunately, because of the numbers game here, there's relatively few people, they have to export some of the confirmatory tests away to labs nearby who can actually do the confirmatory tests. But the point is, we have to inspect just as the data on the cases has to be documented. Everything to do with the lab has to be documented as well. That's the way we do it.
Nice. Did you have an opportunity to evaluate public and private labs?
We visited one private lab, and I must say they certainly comply in the private lab in exactly the same way as the public sector as well. To be perfectly honest, there's no great advantage to being private rather than public, because they have to send confirmatory testing out to another lab as well. So but both seem to be sort of compliant in terms of the kind of testing that's done. The one thing we didn't do, of course, was we didn't go through the documentation that's kept in the private lab, and because I think that was a bit too much to expect of a private enterprise. So, but having said that, somebody who goes to certainly the private lab that we inspected are getting tested according to international standards per se.
Dr. Ballard, can you share with us how the assessments has been going so far?
Well, they've been going very well. I must say the lab manager at People's Hospital, the staff at the People's Hospital have been really, really great and welcomed us with open arms, because we've been probing in all kinds of places. And I must say there have been absolutely no barriers to us looking for the information and making some suggestions along the way as to how things could be accommodated. So I think it's very important that everybody realizes that the rates of congenital HIV and the rates of congenital syphilis are almost nil in this country. So it's when I say almost nil, it's just 1 or 2 possible cases in the past few years. So, you know, this is actually very difficult to do because everything is negative. So as an assessment, I'm used to going to countries where there's a loss of disease. And so this has been quite an eye-opener to me. And I must say, including the private labs that we've visited, people have been most cooperative, and we do appreciate it so much.
Nice, nice. Now, Dr. Chickie More, I want to come back with you. You mentioned earlier in the interview that you were responsible for the human rights element of the evaluation. Speak to us a bit on why that is important.
Okay. So the human rights piece has 3 components. Okay, so it's the human rights itself. Then you have the gender considerations, and then you're looking at community engagement. As UNAIDS, as the epidemic unfolded, initially the response, if I can go back, initially the response was very biomedical. It was, you know, diagnosis and treat, and the engagement of people and the human rights piece came much, much later. But what we found is that if you didn't think of the human rights considerations and there were no laws and policies in place, that certain things were going against the Human Rights Charter. And issues of protecting people's right to not be coerced or forced to take a test or to be put on treatment or sterilized because you're HIV positive, or lack of confidentiality, which then resulted in stigma, you know, sharing. But policies and laws were not in place at the time because things were evolving. You know, we're building the ship as we sailed. But over time, we realized that without addressing the human rights piece, we're never going to win the battle against HIV and AIDS. So UNAIDS, really, our board is largely made up of civil society and the affected communities. So they play a key role in designing the policies and the programs that affect them so that they are a bit more responsive to their needs and that we make sure the human rights considerations are there. And also, if you're talking about issues like stigma, how do you address stigma from a government perspective? It's very difficult because it's not something you touch, feel. It's not something you fix by, you know, writing out a policy. You have to change the mindset and perceptions of people. So ideally, if you're going to succeed in successfully addressing a program like this and reaching, you know, elimination of mother-to-child transmission, our assessment here is what are the human rights considerations? And amongst the questions we ask or we look for are, was there privacy? Was there informed consent? Did the women know what services were being provided to them and did they agree to them? And then, of course, are there laws and policies that say if you're positive, you'll be criminalized? If you transmit to someone else or if you infect somebody else, or if you as a woman pass on the infection to a child, would you be criminalized? Would you be, you know? You actually, we had countries that had such laws in places, yes. Wow. Criminalization of HIV. So over time, UNAIDS documented and actually brought this to the attention at a global level and then pushed it down to regional level and to countries through the UN system. And we've actually reached a place where very few countries now have policies and laws that discriminate against HIV and AIDS. So when we come to BVI, those are the things we're looking for. And we review your policies and your laws and regulations, and then we see how they're being implemented in the facility. And then, most important of all, the rights holder, the woman that's affected by HIV, the woman living with HIV, the woman receiving services, the woman in antenatal care, any pregnant woman, how do they perceive these policies and services? Are they happy with them? Are they informed? Do they understand what they are? So if the policies don't filter through, then we know there's a gap. But the most important thing is we don't penalize the country for that, but we make recommendations that you try to address them so that you can strengthen the programs. And then you find that when that happens, the stigma levels do reduce. People are better informed, they understand the issues, but we make very good policies, but sometimes they are not understood by the community. So it's also difficult to assess your own programs. So sometimes it's helpful when you get outsiders coming in to come and ask those questions and see how they're a bit more objective. So that's the purpose of the human rights piece, that at the end of the day, if we validate a country, then we're basically saying it's a check that you have actually implemented your program in a manner that's consistent with the human rights charters, policies that have been agreed at, at global level, at national, regional level. And that's the way we're supposed to do it.